So, welcome, friends and family. This is Nurses Talking, and I am Dale Barzy. As usual, if you like what you see, give us a like, give us a subscribe. Today, I have with us Anita Farrelly. I hope I said your name correctly, Anita.
It's actually Anita Farrelly.
Farrelly. Okay,
Yeah.
Anita Farrelly. Anita is a registered nurse out in Arizona, and she has had a wealth of experience. Still working in the clinical area as a manager, as a nurse manager for ICU, CB ICU, and something else,
Progressive Care Unit.
and progressive care unit. And Anita is also a business owner. She owns Hydrate and she owns a Boost Wellness, both in Arizona. And she's going to tell us all about that. So welcome, Arizona. I said welcome, Arizona, and I did mean welcome, Anita.
Thank you. Thank you. I'm glad to be here.
So officially, thank you so much for speaking to me. One of the things that really drew me when I looked at you was your, I don't know if this is your mantra, but it said endless possibilities, and that just resonated with me. I love that.
Yes.
So,
I
uh-huh.
no, that's just something that's very, very important and I'm passionate about. Yeah.
Somehow I got that. That came across right away.
hmm
So one of the things I really want to know when I speak with nurses, the things that I want to know first and foremost is, why are you a nurse? What made you become a nurse?
Well, I've been a nurse for over 25 years. Um, I was influenced by a someone in my family, of course, someone who had been a nurse. I thought growing up, she was just amazing. She was a very caring mother, had 6 children, worked really hard, though, professionally on her career. And I got to go up to the hospital and have lunches with her on occasion. And just being in that energy of the hospital was made such an impression on me at a young age, probably grade school age. And then later in life, I had another influence of another. My sister married a man whose mom was a nurse, ER nurse, and she just was smart as a tack, strong with communication, but loving and healing, and just really made an impression on me. So I wanted all the soft of the compassion and love, but I also wanted the toughness and the communication and the um, owning my own,
Uh-huh.
having my having my stand in what I was doing. And
Yes.
so
Yes.
it kind of mixed the two perfectly.
Awesome. 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 So as I said, I see that you've done so many things during your nursing career. So tell me about some. I know that you're in critical care at the moment.
Mhm.
And what drew you to critical care?
I graduated in 1994, and it was at a time when there actually was not there was an abundance of nurses. There was no shortage.
Yeah.
And it was a fear that most of us were not going to get jobs. A lot of nurses graduated, got their boards, and ended up working in wherever they could get a job. I was really, really lucky my senior year of nursing school that I worked for a hotel, and his best friend was a CNO of a hospital.
Okay.
So she got me the job as a nursing aide in the neuro ICU at Barrow Neurological Institute down in Phoenix.
Okay.
I loved it. Like, I loved it. And it was that perfect blend of soft and caring with, you had to know your stuff.
Yeah, yeah, yeah.
There was no room for mistakes. So it just happened that way. That's just where I was supposed to be. So I didn't say or declare this is what I'm going to do. This is just where it worked.
That's what grabbed your heart. You went there and it grabbed your heart. Awesome, awesome, awesome. So tell me, a day in the life of an ICU nurse.
Well, it's intense. You have your one or two patients. You're doing your head to toe, but you're doing your head to toe with focused on every single part that has to be that's connected to the other part. It's one of my best friends is an ED nurse, and so they kind of stick with what the chief complaint is. But in the critical care, this affects that, affects that, affects that. So you're always big picture. And I do a lot of training with the new graduate nurses, and I always share with them that critical care nursing, like the first year, you're very task oriented. Check, 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 you're doing. And then there comes a shift where you're being a nurse. And you're standing at the foot of the bed and you're looking and you're taking in everything. From the color of the skin, the urine, the eyes, the monitor, the way they're resting, the way their face looks, the way, you know what the labs were and what the diagnostics were, and you're being a nurse, and it all like becomes like a symphony, and you understand what's going on.
Yeah, absolutely. Actually, that's one of the best descriptions I've heard yet. That is one of the best descriptions I've heard yet.
Thank you.
So, now that you've done that, I see you used to be a travel nurse too, right?
I did. Mm-hmm.
How did you like that?
Oh, I love that. I was 24, 25. Before, I always say it was before kids, mortgages, houses, dogs. So I did, I went to Palm Springs first because I was a little too chicken to get too far away from home. And then I went to New York City. I stayed in New York City for 3 contracts, lived in Manhattan, worked at NYU. And then after that craziness, I went to San Diego and chilled there for a while. And then ended up coming back to my home in Phoenix.
Okay. So do you think those experiences, those travel nurses experiences, strengthened you?
Yes. 100%.
Yeah. I actually wish every nurse could do that.
Yes. It taught me life. It taught me financial management. It taught me, I worked in a neuro ICU, a trauma ICU, a medical ICU, a cardiac ICU. I learned how to work with nurses who wanted nothing to do with me, to nurses who were so excited and wanted to be my best friend. I learned how to step outside of my apartment completely by myself, go get on a subway in New York City and just get off one stop and surface and see where I am and go explore.
Yes.
Absolutely.
All right. Awesome. So how did you move from that into this business that you own? You own Hydrate and you own a Boost Wellness. Tell us what this is about.
I always called myself a wannapreneur. I had, when I settled back in Phoenix, they were just opening up Mayo Clinic, Arizona. And I was hired on. I just preferred day shift ICU, please. But what happened was I ended up getting hired into a leadership role.
Okay.
So I came on before the hospital was open and helped policies, procedures, supplies, hiring all the staff, putting the education together, creating the culture. And that was for the ICU for the Mayo Clinic Hospital in Arizona. And so I ended up working at Mayo Clinic for 19 years. And in those 19 years, I became what I now know is a term called an entrepreneur. So I was always loving project management. I was always moving to the next project. So
yes,
I, after opening the hospital and then after starting multiple programs in the ICU, like the liver transplant program, a nurse mentoring program, then I worked with, I helped open up intermediate and solid organ transplant unit and was a manager for that. I helped open a primary care and was a manager for that. So I was always building.
Yes.
And at the same time on the outside, I was dabbling with I became, it was the multi-level marketing. I became a consultant with Rodan and Fields, loved it, and got my little taste of freedom of doing my own thing when I wanted to do it. And so I knew that I wanted to do some kind of business. So I called myself a wannapreneur, shifted from the entrepreneur because now I wanted to do my own thing outside of the business. I actually wrote a book first. So that was a check mark for me. And then once I knew and I got that I could do the unreasonable, which I felt like that was very difficult and challenging and unreasonable, then I knew that I could do a business.
Okay. Okay.
Mhm.
And you mentioned your book. Is that the you? I saw that you wrote a letter to yourself, by the way.
I did. Yeah.
That was such an awesome idea. So the letter that you wrote to yourself is to you in the present or to you in the future?
To me in the future.
How far in the future?
You know, I didn't really define if that was like 1 year or 5 years. You know, this last year, the storm of this last year was pretty overwhelming. And in addition to COVID and managing an ICU, that turned into a COVID ICU. We went from 30 beds to 60 beds.
Wow.
And then I opened up my business. But before all that happened, I actually went through a divorce
Okay.
and bought my own house and moved out and have a 13-year-old and a 16-year-old. And then didn't realize that menopause is not a phantom thing. It is
Real.
very real. And one day when you wake up every day in tears and emotional and alone and
Yes.
trying to heal from all this stuff and then going to work with a smile on your face and not making it about yourself because this pandemic is happening. Yeah, there's been some very sad days. And so really on a healing journey.
Okay. Okay. So honestly, I read that letter. It really is a beautiful letter.
Thank you.
To yourself. It really is very profound. So to come back to your business then, what made you choose this? So tell us what it is about anyway, because I know I read it, but tell me what is Hydrate and Abuse Wellness. What are they about?
Sure. It's the product, the service is IV infusions, vitamin infusions. For me, it's not about the infusion. It's about wellness and prevention. And I worked in the hospital for all of these years, and getting to go to people's homes and giving them vitamin infusions that help them from I'm doing okay to oh my gosh, I feel so much better is different than being in the hospital with really sick people. A different kind of rewarding. How I see the vitamin therapy though is that there's a lot of people. My mom has this fibromyalgia.
Okay.
She's also, in her 70s. She doesn't eat well. She doesn't stay hydrated, and she has an aging GI system. So
Yeah.
the food she's eating, what is getting absorbed? It's hard to say because their guts have so much inflammation and malabsorption these days. And she's got chronic pain, nerve pain, muscle pain from the fibromyalgia. So I give her, they're called cocktails, but once about every 10 to 14 days. She still is taking her pain medications and doing her supplements, but what this does is it's just an extra boost, and that's why it was called a boost of the B complexes, the magnesium, which is really good for vasodilation, smooth muscle relaxation, helping with her joint pain, helping her with her nerve pain. I give her a little B12 for some energy. I give her some glutathione because we're in a world of pandemic and she's high risk with her comorbidities. And so that master antioxidant to just really protect her whole immunity system. And the hydration. So that I can, keep her, she's on medications also that promote dehydration. So these just kind of, I can tell the difference between a couple of days on if she's had an infusion lately or not.
Okay.
So I love it. And that's what we do. To me, it's not about the infusion. To me, it's about people, you've got mind, body, spirit. Love that order, but in reality, how I see it is body. If our body is out of whack, if our body is not working right, if our body is hurting or in pain, it's really hard for our mind and our spirit to be fully present and connected.
Okay.
So this is a way to connect it.
Awesome. So question, has COVID, I know that you're going into people's homes to do this. So has COVID affected that at all?
No, we use PPE, and we have the client use PPE. At the height of COVID, some of our patients were in fact um, positive. They were home with the positive diagnosis and they just couldn't kick it. And they still had the fatigue and the headaches.
Mhm.
So one of my nurses early on had the antibodies. She'd had her own exposure. I have the vaccine now. I've had both doses. So we've not, we've done really creative things too, from like the one who had a house full of 4 kids. Everybody was positive. She was worried she was going to get it. We didn't want to get exposed. It was still like unknown, all of the transmissions. So she sat in her car and put her arm out the window, and the nurse wore the gown and the PPE and the everything, and started her IV and hung her bag of immunity boost, and stepped away from the car and went and hung out. And so, knock on wood, yeah, we were able to really help some people just get over that edge.
You had to get really creative.
Yep. Sit outside. But yeah, definitely protecting both of us.
Okay. Well, you know, that's what we do actually as nurses. We have to get creative all the time.
Yes.
So you've got so much going on, Anita. What do you do to relax?
Oh, I love to meditate.
Okay.
I discovered that a few years ago. I started, you know, in neuro ICU, and I became very passionate about the brain. So, so meditation is extremely important for calming that, you know, nervous system. I am social. So when I'm with people, I'm connected, and that also calms my nervous system. I can be alone, that's fine. I can get a lot done. But I have a couple of close friends. Like last Saturday, we just got in the truck and drove out up into the mountains. We were trying to find a little town up there, but we got lost. So we never found it, but it didn't matter. Like I'm good with the no time agenda. Turn off the electronics and laugh and really be present. So I do that. I have my little dog here that's gotten me through a lot of tears and worries, but so I do things. And you know, I going through the divorce and everything, I started seeing a counselor, and I go to her every week. And I have for over a year now. And I can't say that we're working on anything in particular, but sometimes it's just that place for me to safely express.
Yeah. A safe place to be.
Yep.
I see your book was Becoming a Warrior Woman?
A warrioristic woman.
A warrioristic woman.
Yes.
And it brings to mind visions of muscles and you know, and not just physical muscles and yeah.
Yes. Yes, it was becoming a warrioristic woman, creating boundaries, confidence, and peace of mind. And to me, that's what it was. It was the muscles. It's based on neuroplasticity. And that, you know, so many of us suffer from that low self-esteem or that doubt. And it was just inviting people to look at, you know, the neuroplasticity and how it happens and how we develop that muscle. That it's kind of our brain's fault too, because our brain has been developed. It's really a fight or flight system with the amygdala. And so it was God's protecting us from exterior threats. But in 2021, the threats are not exterior anymore. They're in here. And so it's bringing awareness to what your amygdala is doing versus your prefrontal cortex, and how you can create new neural networks and really develop that muscle of confidence. And
awesome. So any other books on the horizon?
I have so many I want to write. Like becoming a warrioristic nurse, becoming a warrioristic entrepreneur.
It's a whole warrioristic series.
A whole warrioristic series.
It's going to be warrioristic for dummies.
Yes. Yes, absolutely.
Awesome. Awesome. So, what would you say now, with all of this experience that you have and all of these things that you have learned, what would you say to someone who wants to be a nurse?
Oh, do it. The door is just open. So first and foremost is that in a world of uncertainty, when you become a nurse and you have that skill and you have that that training, you can do so many different things.
Mm-hmm.
It opens the door to sorry, I'm just gonna plug the computer in. It opens up the doors to anything. Like I ended up getting my master's in business and not master's in nursing, and
Right.
I love nursing. Now I'm thinking, do I want to go get my nurse practitioner now too? Because I love business and operations and logistics, but I also love people, and I'm learning like the clinical and functional medicine excites me. I've been anything from an ICU, nurse in multiple different kind of units to I did quality management for a while. I did a unit-based educator for a while. I worked in a primary care clinic. I did a house supervisor. I've done manager. I mean, the possibilities are endless.
I know.
When you become a nurse, you can do anything.
Yes. Yes.
So
you really can.
You really can.
You really can. And that's one of the reasons I kind of want to do this, because I want us to see this, that we can really do anything with this profession. Very often starting out, we don't really know that.
Mm-hmm.
We don't really know that. And, you come to see this as you go along. And sometimes we pigeonhole ourselves into one little thing and don't really see all these possibilities. So
yeah.
I'm glad you said that.
I got the tattoo to match it. Oh, can you see it? It says possibilities.
It says, okay, awesome.
my 50, my birthday this year was 50, and that was my gift to myself, was my first and only tattoo.
Good. So that is it. So you're wearing your vision board.
Yes.
Great.
Yes,
So Anita, do you have any stories you'd like to share? I know nurses have a lot of stories, and I say, do you have a story you want to share?
They're usually gross.
Yeah, that's what someone said. They said just be mindful of HIPAA. But they are right. They usually gross you, right?
They usually gross. Like the first one that popped into my head was because I worked neuro ICU and there were a lot of spinal cord injuries, and so you had to help them with their bowel management. And
yeah.
And when I was probably 20 years old, and I learned what a dilly was, and I remember in the the road arrest beds that mechanically turn, and
yes.
And I remember thinking, oh, if my friends could see me now. Yeah. So, but here's the thing that and it's not so much a story about nursing, but it's a story about nursing. I teach a resilience course at work where I go to where I'm employed, and one thing that the story I talk about is that my daughters, they when I asked them, do you want to be a nurse, they were like, ew, gross. Mm-hmm. I don't, boogers and snot and stuff. And I'm like, hey, here's the thing. The patient doesn't want it either. Like, they don't want
exactly.
ew and gross and whatever. And if you can not make it about you, but make it about them, then you're a nurse.
Exactly.
If you can, like everybody's always afraid to call the doctor, and they call the doctor and their brain freezes. And it's like, wait a minute, you're making it about you.
Yes.
You got to take you out of it. Mm-hmm. This is not about you. And if you can take you out of it and talk to him, her about that patient who's laying in that bed that needs you to be clear and selfless right now, then you're doing what you're supposed to be doing.
Indeed.
Mm-hmm.
Indeed. And that's a wonderful way for us to wind up this little chat. Thank you so much, Anita, for talking to me. Thank you again. And I really do wish you so much success
Thank you.
I see all these things that you're doing and all these things you've got going, in parallel lines, and I really do wish you success.
Thank you. Thank you so much for reaching out too.
You're welcome.